Welcome to episode number 5 of the WWIM podcast. That's WWIM podcast, Women Who Inspire Me. Our guest today is the beautiful, talented, lovely, empathetic, nice, kind, super nurse and neighbor of mine, Joan Thomas. Thank you for being on.
Thank you for inviting me, David. I have known you a long time. Thank you for those kind words.
Yeah, you're welcome. When did you move to Westboro? It was 80?
We moved in 1980.
Wow.
We came July of 1980,
Wow.
yes. My husband pulled me here kicking and screaming because I always thought we would go back to New York City where we started. And he went to BC, Harvard, and then switched to Mount Sinai and just loved it up here. And this became home.
So you moved to Did you move to Massachusetts before Westboro?
Yes.
Okay.
We lived in Norwood.
Okay.
Well, actually, the first time we lived in Norwood was in 1975.
Whoa.
Carrie was 10 months old. And Bob came up to do an infectious disease fellowship at Harvard. He was working on, I don't know what he was working on, to be honest. I think some kind of herpes simplex virus. And we lived in Norwood 1 year, and I was miserable. I just wanted to go home to New York, where my parents were.
Right.
And we did. We went back home again. And then in 1979, after Aaron was born, he said, I really want to live in Massachusetts. And I went, forever? And he said, I think it would be a good place to raise our children. And so 79, we moved back to Norwood.
Wow.
And then in 80, he said, we should buy a house. I said, why? I'm used to having a landlord and a super to do all the work. And at that point, he said, I think it would be good for us. I'm like, he's not handy. Bob's not handy. I don't know how this is going to go down. So we moved here in July of 1980. So we've been here a long time.
Wow.
Yeah. Yep.
So what got you, before you even met Dr. Bob, your upbringing, did something get you into nursing? Joan was a nurse at UMass when I was going through my major life medical challenges.
You had a couple of them.
I have a couple of them.
Yeah.
What is someone get you into nursing? Like what?
Back then, growing up as a kid, post World War II, it was very limited what a woman could do. Being Irish Catholic, or BIC, which we call Bronx Irish Catholic, you could be a nurse, you could be a teacher, or a nun. Nun was struck that right up. There was no way that was going to happen. Teaching, and when I was about 14 or 15, I was a candy striper at Misericordia Hospital in northern Bronx, and I thought, I could see myself doing this. Okay. So I knew from an early age what I wanted to do. As a dear friend of mine, Helen Mullen, who has also taken care of you, another nurse.
Happy birthday.
Happy birthday, Helen. She always said it's not a profession, even though it is. She thinks of it more as a vocation.
Right.
And the older I got, the more I realized she was right. I did agree with her on that. I did, yeah.
So then you became a nurse in a hospital in New York after that, or?
I rebelled. Having spent 12 years with the nuns, I applied to Mount Sinai School of Nursing in New York City, right on Fifth Avenue. And my father, of course, clutched his chest. He wanted me to go to a Catholic school of nursing. He wanted me to go to St. Vincent's, which was down in the Bowery. And he said, Mount Sinai's in a terrible location. Right. It's in Spanish Harlem. I said, what's the difference between Spanish Harlem and the Bowery, Dad? And then I kind of nailed it. And I said, you're not going to have to pay for this. It's grant funded.
There you go.
I said, so I'll come out with maybe $500 in grant that I have to pay back. And he said, okay.
So that's where you're going.
So that's where I went. So I've been a nurse 51 years. I graduated from Mount Sinai in 1971, but I continued to take courses.
Right.
So I took courses at Hunter College, and I finished my bachelor's degree in 1975. Carrie was 10 months old, and I finished my bachelor's degree in 75.
Wow.
Yeah.
But you had already met. Where did you meet Dr. Bob?
Actually, he was doing a sub-internship, they called it back then, in med school. He had left Harvard because he was in Harvard Dental School and decided that's not what he wanted to do.
He figured that out. Thank you, Lord.
So he was doing research at Mount Sinai, and then he decided to go to med school, finish med school at Mount Sinai. And I was doing second shift, which was great because in New York City, you leave at 12:30. There's always a place to eat.
Yeah, right.
And I was doing second shift, and I was in the med room, and this tall guy touched my right shoulder, and I turned around and looked up at somebody 6'4". I'm like, what the heck? And he said, Miss Garvey, can I have the keys to something? And I went, okay. That was it.
Wow.
That was it.
That's all it took?
That's all it took, yeah.
So then you started talking or what?
Well, we had a very interesting encounter because I had taken care of a little 10-year-old boy that had a brain tumor. Oh. I was his primary nurse, and Bob was he was an intern at the time. He was the doctor. Yeah. And he kept saying to him, I want you to meet my nurse. I want you to meet my nurse.
The patient said that to Dr. Bob.
The patient said that, and Bob asked me out, and I thought, what the heck
Did
am
he
I
set up the kid?
The kid said David.
No, they just said his name was David too?
His name was David
crazy.
too. And he ended up being coming to our wedding.
Oh my God. Well,
he ended up saying to him, ask my nurse out. And I thought, I said yes. And then I thought, what am I going to talk to this guy about? And a month later, we're engaged.
Oh, it only took a month?
Yeah.
Oh, my gosh. So where did he grow up? Where did Bob grow up?
He grew up in Ossining, New York, where Sing Sing Prison is. Okay. So he grew up in Westchester. Okay. I'm a Bronx kid through and through.
It only took a month.
Yeah.
Wow. Yeah. What did your parents think of that?
My mother went. And Bob wanted to get married when he graduated from med school, which had been 1972, and my mother said, "Oh, I can't pull it together. I can't do it that fast." And so then Bob said, "Well, what about September?" My mother said, "No, I can't do that either." And then he said December, and my mother says, "Nobody gets married in December." And I went, Mom, you and Dad got married in December. That was different. It was right after the war. So she made us wait a year. She figured I was immature.
Well, you were, how old were you? 21?
I had just turned 21.
Yeah, that's crazy.
So she made me wait till I was 22 to get married.
I think my mom was 22 as well.
Your mom was young too. Yeah.
Wow.
I mean, it was different back then.
Right, it was. Well, that's the thing is you could graduate college back then and have a job and have a family with a college degree back then.
Right.
Not the case now. Now here's some debt.
Yeah, and exactly. Exactly. And I didn't ask him how many, loan coupon books did he have, because as you know, he went to BC and med school. So, So a lot of our friends were buying houses and we were still in an apartment. It's just the way it was, and you just do what you have to do.
So you got married, and how long after you got married you said you moved to Norwood?
We got married in 1973, had Carrie in 1974, moved to I got my bachelor's degree in 1975 and moved to Norwood in 1975.
So busy couple of years.
It was a busy couple of years, yeah.
And then, so you were in Norwood, and then was it Norwood to Westboro? Or
Norwood to back home.
New York.
Back home again,
okay.
yeah.
And then...
And Erin was born in New York City also.
Oh, okay.
Both girls were born at Mount Sinai.
Oh, wow.
Yeah.
Okay.
Yeah.
Interesting.
Yep.
And then you moved to Westboro in 1980.
Yeah,
we did. 1980.
Yeah.
You moved to Westboro, and then did you both start working at UMass at the same time?
How
did that work? Okay.
I was a stay-at-home mom.
Okay.
Hung out with your mom, and we did all sorts of things. And my parents died around the same time as your grandfather Hayes.
Yeah.
And in fact, when your grandfather Hayes died, Mary Beth called me and told me what's going on. And at that point, she said to me, "Can you go tell John and the kids, I don't want them to hear it just hear it."
Right.
So I remember going up.
I remember that.
John was 15 at the time. I do remember that. And I just remember telling him that his beloved grandfather had passed. And that was
God.
that was a hard thing to do because John was really emotional about
yeah.
You all were.
Yeah, I was really, I mean, I was as sad as a 9-year-old could be.
Yeah.
Like, I was sad, and but when you're 9, you don't really, I don't think you really have the emotional process to
You don't realize it's
what
forever.
it's like. Yeah,
exactly.
right.
Yeah, they're not coming back. Yeah.
This is my grandfather, who I was actually named after.
I know.
David
Hayes.
McGrath.
Yeah. He was a captain.
McGrath. Do you say McGrath or do you say McGrath?
I say Mary Beth McGrath.
Yeah, you do.
And I say Paul McGrath. And I say all the McGraths. Anyway, I know. And
you're Irish too, so you
through and through. Both sides.
So when did you, so you must have been, so you're raising Carrie and Aaron.
And then my parents got sick.
Yeah.
And it was back and forth into New York, New Jersey.
Right.
Both my parents, my mother got sick first, then my father, and they were both sick at the same time in 2 different hospitals. So it was very, if it wasn't for your mother and your Aunt Carolyn and the neighbors, it was a very, very difficult time.
We were a great neighborhood. Like, we would take care of each other.
Absolutely. Absolutely.
I don't think neighborhoods have that feel anymore.
No, we had the Igos, the Robinsons, the Fulhams. Yep. Actually, your mother took more care of the Fulhams than...
Well, there was 5 of them.
There were 5 of them, too. Yeah.
Well, and that's the thing. Back then, you wouldn't... Like, there'd be no play dates. We'd just hear... you go outside and hear where the...
out in the back.
You just hear where the voices were.
Yeah.
And you'd be like, oh, they're playing at the Robinsons. Let's go down there. Like,
and you guys were always in the woods. Luckily, you weren't always covered in poison ivy. But anyway, yeah. So I didn't go back to work at Mount Sinai. Excuse me, UMass. After my mom died,
so that was early 80s.
Yeah, I was just constantly cleaning, and Bob would come home and he'd say to me, they need nurses up at UMass. I'm like, well, why would I do that? He said it's a really good hospital and their nurses are great. Okay. So they had an open house, and I went. And I interviewed, and I started there per diem, inpatient on 5 East, where you were. And the rest is kind of history. So
and then you were there till 2 years ago, right?
Yeah. I ended up retiring 2 years ago, March 6th. And that was due to the fact that my daughter Carrie said to me, Mom, you've been doing this a long time. You deserve to get some enjoyment instead of always running around. And I thought about it. She said to me, well, think about it. And so I prayed on it. And I said, Bob, look down, tell me what do you think. And I went in a week and a half later, and I said to the nurse manager, she wanted a 3-month.
Like for COVID, she wanted 3 months.
It was prior to COVID.
Oh, okay.
She wanted
before.
3 months because she wanted to get systems on board.
Oh, yeah.
Because I was certified in pedi-oncology.
So you're a super nurse.
Not quite, but I gave her 3 months notice, and I picked an arbitrary date, which was March 6th.
Right. So it was just...
Right. And then my retirement party was March 13th, and everything shut down.
Right. And then they asked you to come back.
And they did ask me to come back last year. No. They just did not have, they didn't have enough hands on board, and I kept my certifications for, IVs and stuff like that in pedi-oncology.
Yeah.
You have to be certified. And so I went back. Per diem. But it was good. It gave me a purpose.
Yeah.
Okay. Yeah.
Well, I still say good call, Carrie.
Well, Carrie really struggled after losing Bob.
Yes.
She really, both girls are really close to their dad, but she saw, because she would come every week and sit with him when he got really sick, and it really hit her hard, and she just said, I would like you to have some good quality time to do things that you enjoy, Mom. So just think about it,
Yeah. Well, you do enjoy nursing, though.
I love nursing. Nursing is a passion.
Yeah.
It really is a passion. I bumped into somebody in the store, and they said, "Are you Joni?" Now, the only people who really call me Joni, people at work and my patients. Right. And I went, yes. And this mom said, "You took care of my son," and named the child. And I, oh my gosh, I remember. We were so scared of getting an IV, and But anyway, it was, yeah.
Any stories from those early days at UMass that you had, like getting acclimated?
I had a hard time because things were so different in New York.
Okay.
In New York, when I worked in New York, you didn't have a lot of nurses on second or third shift. And you were used to just doing everything on your own. I got up to UMass, and it was nice to have more licensed people, and that you could communicate with one another if you had a problem. Like one day I was concerned about a patient, and my friend Helen, as you know, Helen Mullen had been there, and so she said, "Oh, let's go, do it together," and we did, and that kind of cemented our relationship, and we've been friends and colleagues ever since. She was the one that kept saying to me, "Please come back, and I'm like, "I don't know if I want to come back, Helen," but anyhow, yeah. So I've been up there a long time.
So you'd been working there probably maybe 5-ish years before when I was diagnosed with.
Yeah, I started there in '85.
Yeah,
I came
so
down to outpatient clinic in '87.
Okay.
Yeah, are we talking first diagnosis or second
First,
diagnosis?
yeah. So
first diagnosis.
88, December of '88.
First diagnosis, I can tell you right now. Bob had said that your history didn't make any sense, and called Michael Hirsch, who was our pediatric trauma surgeon, and said to Dr. Hirsch, history doesn't make any sense, but I'm sending him up. Something's going on. Of course, he got the call from Michael Hirsch that night and said, "Thanks a lot, Bob," because Dr. Hirsch was in the emergency in the OR with you for hours on end.
So a little backstory. So when I was like probably 11, 12, I started having symptoms, gastrointestinal symptoms,
but ignored them.
And ignore them. I'm Mr. Hockey Player, tough guy. I can deal with it. Till it was so bad that it got to the point where Dr. Bob came to our house, did an exam on me, and was like, "Yeah, you got to go to the emergency room."
Yeah.
So that's then. So did he call? Did you were there when he called?
Yeah.
And
Oh yeah. Yeah.
had no idea what was going on.
No.
They thought it was going to be a 45-minute take out my appendix.
Right.
But it was like 4 hours.
But Bob kept saying the history's not making any sense.
Yeah.
And at that point, I won't discuss what happened to you. That's your story. But Dr. Hirsch was in the OR for a long period of time.
Yeah. Yeah, they came out and told my parents, it's not really his appendix. We were taking more out. And I don't know if they diagnosed me with Crohn's right away. I don't know.
I think after the pathology,
I
had to send it to pathology to see what was going on. Yeah.
And then Dr. Bob and Joan would visit me many, many times as I was recovering. I think I was in for like 2 weeks after they diagnosed me and did the surgery. I was in the hospital for Christmas. That's always fun. But stuff that's got to be tough for you, even as a nurse, to see kids in the hospital, probably missing birthdays,
It's hard. It's hard.
Yeah, how do you
deal?
Like
the one thing that I loved about working in New York, working second shift, I would alternate with another nurse who lived far away from home. I was in New York. I could travel back. At that point, we were living in New Jersey because the Bronx was really bad. So I would say to her, "I'll work Christmas Eve. I'll work Christmas because I can go home afterward." The best thing about that was you had Macy's and Gimbel's, okay,
right.
2 huge New York department stores, and they were always in competition. But they always would send toys to the hospital.
Oh, nice.
And so as second shift nurse, you would, as they were sleeping, you would be putting out all the presents.
That's awesome.
One year they got Bob to play Santa Claus, which was really kind of neat. He was very skinny back then, so he,
Was he ever not?
he weighed a little bit more back then, but he still needed padding.
Yeah.
So that was very rewarding.
Yeah, I'm
really
sure.
rewarding. Yeah,
Sure.
yeah. But we try. UMass does the same thing. You try to send as many kids home or give them a pass,
Right.
so they can, if they're able to.
Right.
I remember you getting a pass to come to Carrie's birthday party when you were in the hospital. Dr. Newberger let you go.
When I was diagnosed with Crohn's, me and John really wanted to go see the Naked Gun movie, and we joked that we were going to take my IV pole out with us into the movie theater.
Not surprising.
So you start working as a nurse at UMass, and there's been some. You haven't been like just a nurse. Like what has been your kind of timeline at UMass? You've worked in different
I worked inpatient for 2 years
Yeah.
before I went down
to the
to the outpatient
yeah.
clinic. And when you think of an outpatient clinic, you think of it, well, child checkups, you think of strep throat,
Right.
you think of immunizations. But in our clinic, as you know,
Right.
we give chemotherapy, we do sedations, we do spinal taps, we do bone marrow biopsies, we do blood transfusions, we do platelet transfusions, we do infusions of the yin yang.
Yeah, you're seeing the sickest, probably the sickest of the sick kids.
We do, and the whole purpose of PD oncology, we get the protocols. It's called the Children's Oncology Group. So it's all these wonderful, brilliant docs working to see what protocol is going to work best for what patient.
Yeah.
And it depends upon the pathology and the micropathology of where they fit into what arm of the protocol they're going to fit into. But we've always tried to have the kids outpatient versus inpatient.
Right. Yeah.
I mean, obviously, a lot of times they will be inpatient if they're running a fever or, let's say, their white count, which helps to fight infection. If they don't have enough neutrophils, you need neutrophils.
Mine was down
Yours,
single digits sometimes, right? Or
the best story I have is taking a look at David and saying, "Oh, we're in trouble here." His hemocrat and hemoglobin were in what we call in the toilet, and we kept saying, "How do you feel?" "Oh, I'm fine." And Bob and I would look at each other and say, no.
Just lie. I would lie.
You know, we're gonna sign that blood tube for the blood bank because he needs blood and platelets. Yes, and you definitely did.
Dr. Bob, who, I would just need blood work done, and he would come and draw my blood on his way to work, so I didn't have to go to UMass just for that. They wouldn't allow. There's no way they would allow that now.
Right. We used to bring your tube in. One of us would sign the tube, either Bob or I would sign the tube, and then we'd process it. Now, of course, everything's scanned like Walmart.
So I have to be there.
Yeah, and everything. Yeah. We scan you. We scan the tube. We scan it all at this point.
When did that happen? When did that start? Like
the
90s?
Scanning,
early 2000s, maybe.
Once we went to electronic medical records, everything got scanned
on a computer. Right, because now when you see a doctor, they whip over the computer. They don't have your charts anymore.
No,
like mine, which was like a book sometimes.
Actually, yours is probably, bigger than this room down in our medical records department. Everything now is in the computer, and everything gets scanned into the computer.
Do you like that? I guess it's probably good in some ways.
It's good in some ways. Yeah. Some way, I'm a hands-on nurse, so. I'm scanning your bracelet. I'm scanning the chemo. I'm scanning whatever IV fluids. I'm scanning, but and I do look at my patients. Don't get me wrong, but I when we first started it,
you didn't have to worry about that. So
I mean, it's checks and balances.
Right.
But also when we were always doing the chemo, it was always checks and balances because you have one nurse check in and make sure that this is the right protocol and the right date for David, and then that nurse would sign off on it, and then the other nurse would take it and make sure and would sign off on it. You have a doctor signing off on it, and then 2 pharmacists signing off it. So all the checks and balances are there. Yeah. And that's key.
But this is the scanning.
The scanning
takes care of all of that.
The scanning. The pharmacy takes care of scanning.
Okay.
And then we still have to have 2 nurses scan.
Do it. Oh, okay.
So like if I'm giving you
the wrong med, the second nurse would be like,
it'll never happen.
Yeah. Right.
Because I've scanned your bracelet and I've scanned the med. And
if it would tell you.
It would tell you immediately.
The wrong kid or this is the wrong.
Right.
Oh, okay.
And you can tell.
That is good.
Yeah.
I mean,
so we've come a long way in that retrospect.
You mentioned the group of doctors coming together and picking the protocol for the patient. Did that was that 30 years? Did they have that 30 years ago?
Yes.
Okay. Yeah.
It's called the COG or Children's Oncology Group.
Okay.
So you have oncologists, pedi oncologists from all over, and everybody's doing research. Like, Dr. Newberger, who has done research his whole medical profession. He's technically retired, but he's still doing research.
Yeah.
It comes together, and they find what works best. We've come a long way. When we first started, a lot of the kids with ALL or leukemia.
Yeah.
They weren't getting IgG, which is an immunoglobulin. These children, unfortunately, their resistance to infection was low. And through research, they found that if we give the IgG, it boosts them up. So now that's part of the protocol.
Wow. Wait, you're
So-
saying like science and research works?
It actually,
Crazy.
it
That's
really
crazy.
does.
Well, I know Dr. Schwen, Dr. Molly Schwen, she
Mhm.
was one of my oncologists.
Yep.
She presented my case. I think it was to Dana-Farber, one
Yep.
of the Boston hospitals. And we're like, this is what this kid has.
Yep.
This is what we're thinking we're going to give him. And they were like, yep, we do the same.
Yep.
So even
It-
though
it's
I
a
was at
collaborative.
UMass, I was still getting
Yes, because
exactly what I would have gotten.
because it is a collaborative.
Yeah.
You can't work in isolation.
Right.
It doesn't work.
Right.
Because if Dr. Schwen would say, okay, well, we found this with Dave, what do you think about this? Should we add another med? And it would be a collaborative effort. But I do remember you getting all this chemo, and I remember you asking everybody to pray for you. And we did. I mean, everybody from St. Luke's in the neighborhood. And I remember...
I asked her, my mom asked.
I thought you did. And I remember you saying, I'm not going to need the radiation. And, of course, that was kind of part of the protocol. And, of course, you didn't need the
No.
radiation. And I remember Bob...
Well, you know why? You know why that happened, right? Well, first of all, I joked with my aunt. I was like, Auntie, so many people are praying for me. They're going to scan me before I'm even done treatment, and it's going to be gone. Like, I actually thought...
You did say that.
I had so many people on my side that it was just
Right.
going to disappear.
And
I know that's crazy to think,
No.
but I already had the
But
victory in my mind.
But Bob already said he agreed with David and said it's body, mind, and spirit.
Well, you know what he did, right? You know this story.
The Pac-Man story?
No, not the
Oh,
Pac-Man story.
okay.
The day that the first. So I was diagnosed with Crohn's in '88, and then '92 I started having different symptoms. But I learned from my Crohn's, and I went to the doctor right away. Anyway, so Dr. Bob, they eventually diagnosed me with a cancerous brain tumor. Dr. Bob comes into my room the day of my first chemo treatment, and he tells me about all these studies he's read that say patients who use visualization have higher success rates. I had no idea what that was. So he told me. So he's like, well, when you're getting treatment, close your eyes and picture the chemo. Picture it going up in your veins, up to your brain, and attacking the tumor. And that's what I did. Every time I got chemo, I did that, and I pictured it getting smaller and smaller and smaller, and I listened to my favorite 80s metal music as I was visualizing this chemo, like literally attacking. Like I would have really vicious visions of this thing really destroying the tumor and making it go away. And then Dr. Schwen she'd show me the scans. After each time, and it got smaller and smaller and smaller. And I think you were there the day they said you don't need any more treatment.
Yeah.
Because I think that was the sickest I ever was right at the...
You were sick.
Right, I was so sick.
You were so
6
sick.
months of like poisoning me, basically,
and what
right?
Did you, I remember one day you said you were going to, what was the term used for what we call vomit? Can't remember
Puke?
Nope.
Hurl?
Nope. Hurl. I'm going to hurl. I'm like, he's going to do what? Yeah. Mhm. But Bob always believed that you were going to be okay.
Yeah.
And I remember he had, when you ended up in CAT scan, Aaron called me, and I was busy with a patient, and I didn't answer the phone, and the secretary did and said, you need to call Aaron. I went, what the heck is she calling me for? She knows I'm at work. Very empathetic mother. So I called her back, and she said, Mrs. McGrath is in CAT scan and with David, and Daddy needs to get there. And I went, all right, well, okay. I didn't know what was going on at that point.
Yeah, it could have been a head injury or something.
Yeah, it could have been, John falling off his bike or whatever. So I text Bob, and I said, can you go to CAT scan? And I'll never forget it, because he came back downstairs, and he didn't.
You must have called him, texting him.
I didn't text him. I paged him.
Oh,
we had
pagers back then.
We had pagers back then. And he came downstairs to clinic, and I saw the look on his face. And at that point, I knew it was not good. It was not good. And I just looked at him, and he said, but it's going to be okay. And I kept thinking, how do you know it's going to be okay? And he said, because he will. David is strong. He will get through this. And he was right.
Yeah. It's funny because, so I'm in the CAT scan machine, and they do one round of pictures, and then the technician comes in and she's like, I'm going to remove this head plate, lean your head back because the doctor wants more pictures. And I was like, oh my, I knew. I was 18, but I was like, for my Crohn's experience, I was like, doctors don't take more pictures if they don't have to. There's something there. So like they're taking the pictures in that second round of the photos, and I'm like thinking to myself, what is it? Like, what could it be? What's going on? Like going through everything, going through like depression, bargaining, anger, going through all those stages. And then I think of my mom's waiting for me outside, and I was like, okay, all of that, I just got to push all that to the side and like, I tell myself you're going to be okay. And then I had to believe it so much. I was like, I know I have to believe it, because if I tell her, she's going to know if I don't believe it. So I better believe it when I tell Mom I'm going to be okay. And she's the one that told me they found the tumor.
Yeah.
At that point, they didn't know it was cancerous, but
Right.
Yeah. I mean, so as a nurse and a neighbor, what's going through your mind? Like, just
I won't say bad words on this podcast.
That's okay. It's been
Holy
done.
SH, the rest of it. I'm like, for me, I grabbed the rosary beads.
Yeah.
And I said, dear Lord, please hold this young man in the palm of your hands. Please lift him up. Please take care of him. He's been through so much. This is a family that Bob and I both love very much. Please help them. Please sustain them.
Yeah. I think it was harder for my family and for you guys. Like, I think it was harder for those around me than it was for me. Because in my mind, I was like, yeah, this is going to suck, but I'm going to get
You're gonna get through it.
Even when I was back at BC. So my last round of chemo was my first weekend at BC. It's my last round of chemo. And that's when they, like a few weeks later, I was back in the hospital, and they're like, you're not going to need the radiologist. You probably know his name. I forget.
Dr. Fitzgerald.
TJ Fitzgerald. With the bow tie.
TJ Fitzgerald.
He came and was like, yeah,
he's fantastic.
I don't know why. The oncologist team doesn't know why, but you don't need radiation. You're done. The chemo did it. And I was like, okay, cool. Like I knew I'd get to this point. And I went back to BC, and one of my roommates was like, well, let's go out and celebrate. And I was like, I kind of knew this day was coming, so it didn't really occur to me.
Right.
Like, yeah, I probably should.
Of course, the rest of us were doing the Irish jig.
Right.
But the thing that struck me the most was when you were so sick and you were in clinic with me or Helen or whatever, you would always say to us, can you check on my mom? Can you check on my mom? Can you make sure she's okay? And it was just that kindness in you. Well, it's always been there. Your parents are like that. Your parents are just phenomenal. They're heroes. Your mom is amazing.
I've said anything good about me is because of my parents.
Your
all the
parents
bad
are
qualities
phenomenal.
I just came up with myself.
Well, we all have bad qualities. We try to hide our bad qualities, but I mean, you have parents that have sustained you through ups and downs. Like I always say to Mary Beth, your mom, our friendship has been together through the joys and sorrows of life, of losing parents and kids being sick and Dr. Bob, Bob being sick. And, we've been there for each other. I don't know if I could have done it without them, to be honest with you. I'm going to cry.
I know I couldn't have done it without Dr. Bob and you. I mean,
I think you probably could have, but you were challenged, David. Bob would shake his head like, "Oh no." He always believed in you, and I do remember one time he went in to tell you to visualize, and I had gone in to tell you. I didn't know he had just left the room, and I had gone in and tell you, pretend you're Pac-Man, and you looked at me like, have they been talking to one another? And I didn't know he had just left the room.
Yeah.
But anyway,
Yeah, certainly a big life lesson to, like, when you picture something, it's way more likely to happen. I think a lot of people don't know that. I don't know if they don't know that lesson, or it's a hard thing to know, I guess, if you haven't done it yourself.
Like with my patients and their families, I always tell them, it's easy for me to say you're going to get through this because I'm not experiencing it. I'm only walking part of the journey with you. But I always tell the kids, you're stronger than you know. I've always said that to the kids, you're stronger than you know. And, we ended up going through this on a personal level also with my great nephew Declan, who my niece Kelly was up. And I took a look at Declan, and I didn't like the way he looked. And I said to Kel, I said, promise me you'll take him to the doctor when you get home. Why, Aunt Joan? And I said, just you and me. And this poor little kid, he's 3 years old. He had to go to the bathroom. I take him in the bathroom. I pull up his shirt. He's looking at me like, why is Aunt Joan pulling up his shirt? And I'm looking to see if he has petechiae, which tells us that his platelet count is low. And he didn't. And I just wanted to make sure Kelly took him to the doctor. And she did. And sure enough, I went in and I told my friend Helen, I think Declan has leukemia. And the next day, Kelly called me and said to me, Aunt Joan, and pregnant pause. And she said, I said, Kelly, I prayed that I was wrong.
Right.
I said, but I've been doing this a long time. And I, of course, I told my friend Helen, I think Declan has leukemia.
And how old was he?
He was 3. He is 17 now.
Christ.
Brilliant
Thank
as can
God.
be. He's going to enter senior year. He went to look at BC. Yay! Go Eagles. That's another story, David. David's dad went to Holy Cross, and Bob was surrounded by Holy Cross people in our neighborhood, and Bob said to David, why don't you go to a good Jesuit school? And of course, when David got into BC, Bob was like beside himself, But anyway.
Yeah. It's funny. I never even thought about BC, and then I was working at Mini Farms downtown, and my cousin Katie called me, who was the first guest on the podcast, and she said, she's like, yeah, me and my mom are going to check out BC. You want to come? I was like, yeah, I'm not doing anything else. Sure, I'll go. And then we tour the campus, and we walk into the Conti Forum. And I was like, this is where I'm going to school. Like, I just pictured myself watching a hockey game there. I was like, and the rest is history.
Yep. Jerry York, who was the hockey coach.
Oh, God,
who
retired.
He graduated.
Same year?
Same year as Bob.
Oh, wow.
67.
I wonder if they knew each other.
I have
That would be
no
amazing.
idea.
Yeah, it's a big school.
Yeah.
So what advice, if as a nurse, what advice would you give not only to a new nurse, a nurse that's just starting, what advice would you give to a patient facing a life-threatening disease? Do you have in your mind, do you have things that when there's a new nurse, you better know this,
a new nurse, I always tell them, pick your role models.
Yeah.
Pick your role models. You want a nurse that's empathetic.
Yeah.
You want a nurse that's kind, and you want a nurse that's going to spend time with the patients.
Yeah.
And that was one of my issues with electronic medical records. I just, I would much rather go in and spend time with my patient and hold their hand or whatever. If you have a patient that is not going to be with you long, you want to be there for that patient. And I tell these young nurses, choose your role models. Yes. And it's interesting because when Bob was teaching the med students, he always would say, choose your role models well. Wow. Look like Mr. Robinson would say, look for the healers. Look for the people that are kind. Yeah. And that's what you want.
Yeah.
You want.
I'm sure you've run into many nurses and doctors who are like, why are you doing this?
Yeah. Yeah. Absolutely.
Like I've said this before about any, especially teaching and doctors and nurses, you could know everything about every disease, every subject ever, but if you don't have good people skills, or don't want to be there for other people, why are you doing this?
Exactly. What Bob used to get crazy about, and he saw that teaching the med students, you had some of these kids, they're very bright, but they had intellectual arrogance. Yeah. And that drove him nuts. He was one of these docs that would take those med students and say, you might write the order for, the blood work or whatever. He'd take them up to the lab and he'd say, these are the people that actually do the work. Right. You're not doing the work, And he would also say, if you really want to know what was going on with the patient to see the changes, speak to the nurse that's taking care of them because they're with them 8 to 12 hours a day. Right. They see those subtle changes. That's why I won't get political on you, but that's why safe staffing ratios is really important.
Of course it is.
It's really important. Yeah. As I explained to my daughter Erin, if I have 5 patients and my first baby's down here and my 5th patient down here is with chemo, by the time I get down, how do I know what's going on
Right.
with this baby that can't tell me?
Right.
Because kids can't tell you
Right,
what's
right,
going on,
right.
you know?
And your energy, the energy by the time you get to that fifth person, isn't.
You got to keep
probably
that
gonna
energy
be,
up.
Yeah, you do, but
You
it's
do.
hard. I'm sure it's
called
hard.
coffee.
Yeah, you gotta tell yourself, well, I gotta
Yeah.
still be up for this guy.
You have to be on your toes
Yeah.
because kids aren't able to articulate
Right.
what's going on, and you get that the hairs on the back of your neck goes up, and you just get that feeling, you know, and you never want to get that feeling that you're going to have to do CPR on a
gosh.
child, you know.
I'm sure you've had that
Yeah.
feeling, right?
Yep.
Gosh, that's gotta be
Yep.
tough. I've always said that, like, I have so much respect for anyone in the medical field, nurses and doctors in particular, but nurses are the ones that were there for me. They were there for me every day, all day, and they were the ones who knew me. Like
Yes.
some doctors do take the time and get to know their patients and are great. There's a lot of great. I love
Yeah.
doctors. I don't want to be anti-doctor here.
I know you're
but
not.
when you're in the hospital, nurses are the ones taking
Yeah.
care of you. Doctors write the stuff, and
Yeah.
then the nurses do it.
Right.
Like-
I mean, I had one patient who, I have a couple of patients that live in Northborough, and one little guy in particular, he was 3, and I ended up with a lot of the boys, which was fine because I had
You have
girls
two
at
girls.
home. And he just, the first time I had to access his portacath. The portacath is a central line.
Yeah.
That
Which I never got. They
You-
actually
you didn't.
offered me, and I was like, nah, just stick me.
Right.
Yeah.
You were very good about that.
Yeah.
But our kids now have portacaths, which, you know, we give them the chemo through
Right.
the portacath. And this little guy was so nervous because it was the first time he was going to have his port accessed. And I think it took me 45 minutes, maybe 50 minutes working with him. And our child life specialists are the best.
Yeah.
They are the best taking care of these children and getting them ready for what we have. I mean, when you think about what we have to do to them.
Yeah.
And
What is that job? There's a job
they
called
they get them ready. They teach them. They'll use like a doll to show them exactly what's going
Are
on.
they social workers or what's their?
No,
Could I do this?
They
Like,
are.
I think
you
I'd be
need
good
a
at that.
You you'd be great
Yeah,
at it.
wouldn't I?
You need a master's
Okay.
in child life.
Oh, I could do that.
What school is it now? Not Wheaton. I think it's Wheaton
Okay.
that has it. They are phenomenal. Our child life specialists.
Yeah.
I couldn't do my job without them.
Yeah.
When they work with the child, if we're doing a sedation, the child needs less medication
Right.
and they don't hurt as much. But this little guy was really nervous. And so I waited. The child life specialist, Chris, was fantastic. She went in and we're working together. And I said, I'm going to wait till you tell me that he's ready. I said, and so I accessed his portacath, and his mother said to me, thank you. And she said, because you waited the next couple of times, it was easier for him. I said, well, that's what we want. We don't want these children to be fearful of us coming in to do this. You know, we want them, you know, and then he's actually going to Algonquin next year.
Oh, nice.
He's going to be. He's
Those
gonna,
success stories.
It
you
is.
must
I mean, that's
love.
what
Like,
we
yeah,
love.
that's what,
Helen Mull and I love that. And my
Yeah.
friend Kathy Guadagnola, who just retired from 5 East, we just, you know, you get. They always tell you in nursing school, don't get too close to your patients.
whatever.
How can you not when they're
Right.
kids?
You have to.
know?
You
But
have to.
He's going off
Yeah.
to school, and when I think about it, the last time I accessed his portacath, he just sat there and said, Joni, just do it, you know? And it was because we waited.
Yeah.
And our child life specialist, you can't do it without child life specialist.
No.
You really can't.
Yeah. That's because for me, getting sick at a young age, like physically you bounce back easier.
You do.
Because you are. But the emotional part, like, I don't, you know, how do you comprehend that? Especially when you're 3.
Kids
Like,
are amazing. I mean, I like grown-ups, but I don't want to work with them. Grown-ups, they just internalized everything. Children know they're supposed to be healthy and well.
right.
And that's their perception.
Right.
You know, of course they have some residual issues going on. And, you know, some of the kids that got intracranial radiation, they might have some learning disabilities, but you filter that out and you figure it out and you help them along the lines. But children are meant to be healthy.
Right.
And that's their perception, you know? We have, the parents are amazing.
Yeah.
I mean, I think of some of the parents that I've dealt with. They are just simply amazing. Their fortitude, their strength is amazing. Like your mother and your dad.
Yeah, I'm sure you've seen the opposite, though. You've seen couples that probably crack under the pressure and are fighting each other and
I have
all that
seen,
stuff.
you know, there's one little boy I took care of, and he did not make it. And his parents ended up, they split up afterwards, and it was hard.
I'm sure
was
it was
really hard.
devastating, and it just affected them, and they couldn't handle it.
Yep.
It's no one's fault, but that's so sad. Well, and I guess that's why, you know, you could, you know, they told you don't get close to your patients. There is good in that, because if you don't get close, then you're not as sad if you don't get close, then the bad stories don't affect you as much. But then you don't have all the good story, right?
Right.
Then you don't but you are close, you get those really great stories, and if you're close to that patient, that's way more enjoyable. I guess that's the balance of it, right? But I think to truly treat a patient, you have to get close to them. Right?
You do, because you have to realize that the little nuances, like like one little girl, she's 16 now. She's absolutely gorgeous, and her mother reminded me that I used to sing "The Wheels on the Bus" to her when I accessed her portacath.
Great song.
I had another patient who has really bad sickle cell disease. I've been taking care of him since he was little. I think he's 21 or 22. And I would always say to him, did I hurt you? And he'd say to me, your singing is more painful than actually accessing my portacath. But, we lost kids. Like one of the little boys that I took care of was getting ready for his Make-A-Wish trip. And I had done all his sedations and all his chemo. And there was such joy. Yeah. And I was in Greece at the time. And I got the call from Helen saying, I have something to tell you. And my heart just dropped, and told me about this little boy that we lost. And I couldn't stop sobbing because I had seen him through 3.5 years, almost 4 years of treatment, and I thought he was home free.
Right.
And that was very hard. Yeah. That was very, very hard.
And you knew Justin as well, right? Yeah. So Justin Horton, got to mention him. So I met Justin at UMass. We were both getting treated for brain tumors. His was on his brain stem,
which is much more difficult.
Yeah, right. Mine was in the middle of my brain, pushing on my optic nerve. But Justin and I were big Red Sox fans. We would request to be in the same room if we were there at the same time. We'd watch the Sox games. And he was 10. I was 18. He was only 10, but we still,
was much younger.
Whatever. I mean, stayed in touch with me when I don't know if you know the whole Justin story.
I don't think I know the whole story.
So stayed in touch when I went to BC. I would go visit him on spring break and stuff. We actually write each other letters. That's how long ago this was. And then my junior year of BC, Danny Manning Jr., who graduated St. John's with me, he had been diagnosed with leukemia a year prior. He died in November of my junior year. And then the end of my junior year, I was in the middle of my drinking. Yeah, I don't know how much you knew about my drinking stories. I'm sure you heard. Yeah. So and that was the thing, is when I was going through treatment, I pushed all the negative and, bad stuff to the side. And then when I drank, guess what? It appeared. It's going to appear, people. And then end of my junior year, just went drunk. I drank everything we had in the apartment. Just basically was alcohol poisoning. They took me to the ER. Then from the hospital, they sent me to McLean's to get help, which I needed. And while I was at McLean's, I think it was my dad told me that Justin had been trying to get in touch with me because it wasn't looking good for him. I'm sure you knew more about that than me. And then while I was at McLean's, he died. And I just freaking I started throwing chairs. I just lost my shit. But it was actually Justin. So I said to myself, well, I wasn't there for Justin because of drinking. Mm-hmm. So guess what? I can't drink anymore. So Justin helped me stop drinking. So even though the loss of him was so tragic, and I think of him all the time, and I think of Danny all the time.
Yep.
And I think of Greg Montalbano all the time.
Yep.
And I think of my friend Patrick all the time.
Oh,
These are guys that have died from cancer that I've known.
And Patrick,
and kind of inspire me to, be the best Dave I can be. Like but anyway, back to Justin. So Justin dies, helps me to stop drinking. Then in 2010, I'm doing the Relay for Life. I don't know if you know this story. So I'm doing the Relay for Life in Worcester. And I would always make the luminary bags for Justin, Danny, Greg. And now I would add Patrick to that if I did another one. So someone came over. The Hope Lodge had a tent. I worked at Hope Lodge at the time. They had a tent. And I'm just sitting there. And someone comes over. They're like, who made that bag for Justin? I was like, oh, yeah, that's me. I knew him, way back when. And they go, oh, his mom is right over there.
Isn't that amazing?
So Justin's mom was at the Relay for Life.
Wow.
So I got to talk to her. I got to tell her, basically Justin saved my life,
Yeah.
So even those tragic stories, I think, have purpose somehow, right? I mean,
I also firmly believe you don't really know the impact you make on somebody else's life.
Right.
It's what that Tim McGrath song, Always Be Kind. And it's true. Kindness spreads like a pebble in the reservoir. It just emanates out.
Yeah.
And that's what we need, to be a kinder, gentler nation. And we need to be kinder, gentler people.
Oh, we do.
We really do.
To everyone.
To everybody.
Right? Even people that you want to hate.
Yes.
People that are easy to hate, too.
Yes.
And that's the funny thing is those are the people that usually need the most kindness and love, right?
They do. And they need a lot of prayers.
Right.
Because but Bob used to always say what Jesus used to always say, whatever you give in his name will come back 100-fold. And I firmly believe that. Yeah. I really do. I mean, I'll tell you the story that when Bob was practicing, he had a family who had no money, and the child needed to be seen. And Bob said to them, the mom says, well, I don't have money for bus fare. I don't have money for a cab. Bob said, no worries. Just get the cab and I'll meet you downstairs. And so I said to him, where are you going? He said, I got to go to the ATM. I said, what? And he said, I got to go to the ATM. And I went, okay. And so mom's name was Mary, comes in with the 3 kids. Of course, Bob takes care of them. And he said, yeah, we have a fund here. We'll send you home in a cab. It's not a problem. And I just looked at him. And I remember my Erin, when she was working in Hartford, there was a woman there that was a housekeeper, and she asked Erin, could she talk to the general manager to see if she could stay in the hotel for a little bit? And Erin said, well, what's going on? And she said, well, I have money for my first month's rent, but not for the security. So she said, and it's a lot of money. And Erin said to her, well, how much is it? And I think it was like $325 or $350. And Erin said, okay. And so Erin went and said, well, don't worry, we'll work something out. And I didn't hear the story from Erin. I heard it from a friend of Erin's. And Erin went and got money out of her account and handed it to this housekeeper. And the woman says, you haven't even worked here long enough. You don't even know me. Why are you doing this? And she said, well, first of all, you need it. I have food on the table. I have a place to live, and it's something my father would expect me to do.
I was going to say, we have a fund.
Yeah, we have a fund. And it would, and I'm thinking to myself, Bob was probably smiling down at her, for doing something like that. Can I tell a Dave story?
Of course.
Okay. So here's my Dave story.
Of course.
I lost my husband almost 18 years ago. My grandson, Nicholas, was a year old, and Nicholas is now 18. And we buried Bob from St. Luke's. So St. Luke's Catholic Church here in Westboro, for me, is cradle to grave because my grandkids were baptized there. Bob loved David. It was like the kid he never had and didn't have to pay for college, so it was great.
And I went to BC.
And he went to BC. I mean, my Carrie turned down BC for grad school. I thought Bob was going to stroke. So Bob died, and it was a hard time for me, as David knows. He was sick for the last 5 years of his life. Katie O'Neill, Dave's cousin, did all the music and took care of that because there was no way I could handle that. And we always knew we wanted Katie to sing at Bob's funeral. So Dave walks into the wake. He walks in with a Red Sox hat. And I looked at him And I looked, Dave, and he said, I just wanted to make sure that Dr. Bob was not buried in his Yankees t-shirt. And it was just the right note. I needed that because it just helped me get through the rest of the night. And I was thinking of Dave, with his Red Sox hat. And I think you placed it on the coffin, if I'm not mistaken. Anyway, so yeah, that's my Dave story.
Well, that's I think the major life lesson that we've both learned, I think, throughout our experiences, that you have to keep laughing.
You
right?
do.
No matter what.
You do.
On the worst day of my chemo, I was still watching a funny movie.
Yep.
And you have to keep laughing.
When Bob was sick, the 5 years that he was in a hospital bed at home, he had The Honeymooners with Jackie Gleason.
Yeah.
And he would use that, and that would boost his immune system.
Yeah.
And he always would tell his patients that.
Yeah.
I mean, besides being a pediatrician, he was also infectious disease.
Right.
And he would always tell his patients, laughter is really one of the best medicine you have,
Yeah.
Absolutely. Yeah.
All right. Well, on that note, I don't know if it's hard to believe for you, but our hour is just about up.
Okay.
So
I am a kid from the Bronx. I still root for the Yankees. I just want to say this, except when the Red Sox are playing
other
teams.
Yes.
Then I root for the Red Sox.
Thank you so much for being our guest.
You're
I hope to
welcome.
have you on again someday.
Thank you. You need your mother on.
I think, or me and your mom, me and you and my mom. I think
because she is one of my heroes. Your mom is definitely one of my heroes. She is the salt of the earth. She really is. And Paul and Mary Beth McGrath have raised 5 amazing kids that anybody would be proud to call their own.
Thank you so much.
You're
Thanks for
welcome.
coming on. Have a great day, everyone.
You're welcome.